The word schizophrenia,
Mm-hmm.
it often brings to mind certain images, doesn't it?
Mm-hmm.
Maybe like fragmented personalities or someone behaving erratically. But what if I told you that much of what we think we know, well, it's actually a profound misunderstanding.
Yeah, that's a great starting point.
Welcome to this deep dive. We're going to try and unravel the complexities of schizophrenia today, a condition that's really shrouded in stigma and, frankly, a lot of misinformation.
Definitely. And we've gathered quite a bit of information for you, pulling from, detailed explorations, but also some more accessible guides.
Good.
The aim is really to cut through all that confusion and get to a clearer picture of what schizophrenia truly is for the people living with it.
Exactly. So our mission here is to give you a clear, informative, and hopefully engaging perspective. We want to move past the stereotypes, the old ideas,
Right.
and really get to the reality of this complex brain disorder. Think of this as your shortcut to being genuinely well-informed on a topic that affects way more people than you might realize.
Hmm.
So let's dive right in. What is schizophrenia, fundamentally?
Okay, so at its core, schizophrenia is a chronic brain disorder. It fundamentally changes how a person thinks, feels, and behaves.
Okay.
And often that leads to a pretty significant disruption in their connection to reality.
A disconnect from reality.
Yes. And what's fascinating, or maybe frustrating, is the source of so much confusion. That persistent myth about split personality.
Ah, yes, you hear that all the time, don't you? In movies, casual conversation.
All the time. And it's so important to be clear. Schizophrenia is not split personality. That's a completely different thing, actually called dissociative identity disorder.
Right.
Exactly. The split in schizophrenia, historically speaking, referred more to a kind of break or disconnection from reality, not multiple personalities inside one person.
Gotcha. So it's classified as a psychotic disorder.
Precisely. Which means it can involve experiences like hallucinations, perceiving things that aren't actually there, and delusions.
Right.
Delusions are like firmly held beliefs that just aren't based in reality, despite evidence.
So these are those profound sensory and thought experiences that really mark these kinds of conditions.
Exactly. And this isn't some brand new thing either. The patterns of symptoms we now call schizophrenia, well, they were first formally identified way back in the late 19th century by a psychiatrist named Emil Kraepelin.
Wow, okay. So it has a long history of observation, yet it's still so misunderstood. Let's talk causes. What actually causes schizophrenia? Is it just one thing?
That's a key point. Our sources really emphasize there is no single cause.
Okay.
Instead, think of it as a complex interplay. You've got genetic predispositions, biochemical stuff happening in the brain, and environmental factors all sort of coming together.
So like a perfect storm situation almost, a combination of what you're born with and what happens to you.
Pretty much, yeah. Genetics definitely play a role. We know schizophrenia tends to run in families.
Right.
If you have a close relative, like a parent or sibling, with it, your risk does go up. The sources mention about a 10% increased risk.
Okay, 10%. Significant, but not deterministic.
Not at all. Then there's the brain itself, its chemistry and structure. Research points towards imbalances in neurotransmitters, those chemical messengers in the brain.
Like dopamine. I feel like I've heard about that one.
Dopamine is a big one, yes, and glutamate too. Think of them like signals getting sent too strongly or maybe too weakly. And there might also be subtle differences in how the brain developed or its physical structure.
Interesting. And what about those environmental factors you mentioned? What kind of things are we talking about?
It's a range. It could be things happening even before birth, like the mother having certain viruses or malnutrition during pregnancy.
Wow, okay.
Or later on, really stressful life events. Substance use is another factor, especially during the teenage years or early adulthood when the brain's still developing.
So things like cannabis use, maybe?
Yeah, that's often discussed, particularly heavy use in adolescence. Also, things like complications during birth, maternal infections, or even early life stress like significant trauma, or perhaps growing up in a very dense urban environment.
It really sounds like a convergence of different vulnerabilities.
That's a good way to put it. And it's crucial, really crucial, to stress what doesn't cause it.
Okay.
Our sources are absolutely clear. It is not caused by bad parenting. It's not a personal weakness, not a moral failing.
That's so important to hear.
It really is. It's a biological illness. You can think of it like diabetes or heart disease influenced by genetics, yes, but also triggered or worsened by environmental factors.
That comparison really helps challenge those old, harmful beliefs. Okay, so let's move on to symptoms. We hear about different types of symptoms. Can we break those down?
Absolutely. It's helpful to categorize them into three main groups. positive, negative, and cognitive symptoms.
Okay, positive, negative, cognitive. Now, positive doesn't mean good here, does it?
No, exactly. That trips people up sometimes. Positive means symptoms that are added to a person's experience, things that weren't there before.
Ah, like an intrusion. Okay.
Precisely. Think of hallucinations first. That's perceiving things that aren't real. Seeing, hearing, smelling, tasting, even feeling things. Auditory hallucinations, hearing voices are probably the most common.
Right, hearing voices.
Yeah, and these voices might comment on what the person is doing or be critical or give commands. Then you have delusions.
Those false beliefs you mentioned earlier.
Right. Firmly held beliefs totally out of step with reality, like believing you're being persecuted or that external forces are controlling your thoughts, or maybe that you have special powers.
Those sound like the really overt, maybe frightening symptoms that often get portrayed.
They can be incredibly distressing, yes, for the person and those around them. Another positive symptom is disorganized thinking and speech.
What does that look like?
It can mean difficulty organizing thoughts, jumping between topics, making connections that don't make sense, leading to speech that's hard to follow, sometimes called word salad.
Weird salad. Like the words are just jumbled.
Sort of, yeah. The words themselves might be real words, but strung together illogically, like the cat flew sideways because purple tastes like Tuesday. Finally, there's abnormal motor behavior.
Belated stuff.
Yeah, it can range from sort of childlike silliness or unpredictable agitation all the way to catatonia in some cases.
Catatonia. Being completely still.
Yes, a state of unresponsiveness, immobility, almost like being frozen.
Wow, that's quite a range under positive symptoms. So what about the negative ones? What does that mean?
Negative symptoms are about a loss or a reduction in normal emotions and behaviors. These can be more subtle, sometimes harder to spot, but they really impact daily functioning.
Okay, like what?
Well, there's flat affect, that's reduced emotional expression, maybe a blank face, monotone voice. Then alogia, which means reduced speech, talking less. Avolition is a big one, a lack of motivation, finding it hard to start or stick with activities. Anhedonia is the inability to experience pleasure from things they used to enjoy.
That sounds really difficult.
It is. And asociality, losing interest in social interaction, withdrawing.
You know, some of those lack of motivation, not finding pleasure, these sound a bit like depression.
Exactly. And that's a key point our sources make. These negative symptoms can easily be mistaken for laziness or depression, which can sometimes delay getting the right diagnosis and help.
I can see that. Okay, so positive, negative was the third category.
Cognitive symptoms. These affect thinking processes.
Right, the actual mechanics of thought.
Yes. Things like memory, learning new information, understanding complex things. People might have difficulty processing information to make decisions, or trouble using information they just learned, or problems with focus and attention.
So it's not just the hallucinations or the lack of motivation. It's also fundamental challenges with thinking and processing information, too.
Absolutely. It's a really broad impact.
And when do these symptoms usually start to show up?
Generally, the onset is typically in late adolescence or early adulthood. Say late teens to early 30s is common.
Okay.
But interestingly, the very first signs can often be quite subtle. Maybe just gradual changes in behavior, becoming more withdrawn, grades slipping.
Yeah.
Things that might not immediately scream schizophrenia.
Not always dramatic from the outset.
Hmm.
So given this huge range of possible symptoms, positive, negative, cognitive, chimera, how is schizophrenia actually diagnosed? Is there, like, a blood test or a brain scan?
That's a really important question, and the answer right now is no. There isn't a single definitive medical test, no specific blood test or scan that says, yes, this is schizophrenia.
Okay, so how do doctors figure it out then?
It relies on a comprehensive clinical evaluation. This is done by a qualified mental health professional, usually a psychiatrist.
So it's based on talking, observation.
Exactly. The professional will carefully observe the person's symptoms, conduct detailed interviews talking to the person, often family members too, to get the full picture. And crucially, they work to rule out other things.
Rule out other things. Like what?
Well, other medical or mental health conditions that could cause similar symptoms. Things like substance abuse, which can mimic psychosis or bipolar disorder, even certain neurological conditions like brain tumors.
Makes sense. Are there specific criteria they look for? like a checklist.
Yes, there are established diagnostic criteria.
Well,
The main one used is the DSM-5, the Diagnostic and Statistical Manual of Mental Disorders.
right.
Generally, it requires a certain number and type of symptoms to be present for a significant period, usually at least 6 months, with at least 1 month of active positive symptoms like hallucinations or delusions. And these symptoms have to be causing significant problems in their daily life work, relationships, self-care.
So it's definitely not a quick off-the-cuff diagnosis. Sounds like it takes time.
Absolutely. Our sources really stress that an accurate diagnosis can take time. It might involve gathering a detailed family history, observing behavior over a period, because, as we said, symptoms can overlap with things like depression or anxiety, especially early on.
And brain scans like MRIs, are they used at all?
They might be used sometimes, yeah, but mostly to rule out other medical issues like a tumor or stroke. They aren't typically used to make the positive diagnosis of schizophrenia itself.
Okay, that clarifies the diagnostic process.
Yeah.
Now, we know schizophrenia is considered chronic. Does that mean it can't be cured? What's the outlook?
Right, so curable in the sense of making it completely go away forever.
Well, the current understanding is no, not in that sense.
Okay.
However, and this is really vital to emphasize, it is highly treatable and manageable for many, many people.
So the focus isn't cure, but management and quality of life. Exactly. With the right, consistent treatment and support, many individuals can see a huge reduction in symptoms, learn to manage the illness, prevent relapses, and lead really productive, meaningful lives. The goal is effective symptom management and supporting recovery.
That's a really important message of hope. So what does treatment typically involve? What are the main approaches?
Treatment is usually comprehensive and long-term. The mainstays are typically antipsychotic medications combined with various psychosocial therapies.
Okay, let's start with the medications. How do they help?
Antipsychotic meds are the primary drug treatment. They mainly work by helping to regulate those neurotransmitters we talked about, especially dopamine.
Right.
They tend to be most effective for the positive symptoms, the hallucinations, delusions, disorganized thinking.
Are there different kinds?
Oh yes, there are different types, different generations. Finding the right one and the right dose for a specific person often takes some careful adjustment by the psychiatrist. It can be a bit of trial and error sometimes. You might hear names like risperidone or olanzapine. Those are common examples.
So it's a personalized medication strategy. What about the therapies? How do they fit in?
Psychosocial therapies are absolutely crucial. They help people develop coping skills, improve social functioning, manage daily life, and understand the illness.
Like what kind of therapies?
Well, cognitive behavioral therapy, CBT, is often adapted. It helps people challenge and change distorted thought patterns.
Okay.
There's social skills training, which directly works on improving communication and interaction because those can be really effective.
That makes sense.
Supported employment and education programs offer practical help with getting and keeping jobs or staying in school. Family psychoeducation is also really important, teaching families about the illness, improving communication, helping them support their loved one effectively.
Involving the family sounds key.
Definitely. And for people experiencing their first episode of psychosis, there's something called Coordinated Specialty Care, or CSC. It's like an integrated, team-based approach. Meds, therapy, family support, education, employment help all rolled into one.
Wow, that sounds incredibly supportive, especially for that critical early phase.
It really is. And sources also mention that a holistic approach helps too. Things like regular exercise, good nutrition, maybe joining peer support groups. It all contributes.
So what kind of results can people expect with good treatment?
It's quite hopeful, actually. With consistent treatment adherence, some sources say up to 80% of people see significant improvement in their symptoms.
80%, that's huge.
It is. But it's also important to know that relapses can still happen, even with treatment. And sometimes, if symptoms become very severe, hospitalization might be needed for a period to stabilize things and adjust the treatment plan.
Okay, now we have to touch on something that often complicates things.
Mhm.
Substance abuse. What's the connection there?
Yeah, this is a really critical point. The sources are very clear. Substance use, alcohol, marijuana, other drugs can significantly worsen schizophrenia symptoms.
Worse than them, how?
It can make psychosis more intense. It can interfere with how well the antipsychotic medications work. It can trigger relapses and just generally makes treatment much more difficult.
So it's like throwing fuel in the fire.
Absolutely. And we see a higher rate of substance use disorders in people with schizophrenia. It's often called a dual diagnosis.
Bill diagnosis, okay.
This means treatment really needs to be integrated, addressing both the schizophrenia and the substance use together. It's also thought that sometimes people might use substances to try and self-medicate, cope with distressing symptoms.
Right, to try and feel better.
Exactly. But unfortunately, it usually backfires and creates a vicious cycle, making the underlying illness worse in the long run.
A really tough situation.
Hmm.
Okay, another really important area, another myth we need to tackle head on is this idea that people with schizophrenia are inherently dangerous or violent.
This is probably one of the most damaging myths out there, fueled by media stereotypes. And our sources are absolutely unequivocal. The vast majority of people with schizophrenia are not violent, especially when they're getting treatment.
It feels like the opposite is often true, that they're more vulnerable.
Exactly. Statistically, people with schizophrenia are far more likely to be victims of violence than perpetrators. Now, is it possible that severe, untreated symptoms like intense paranoia could sometimes be linked to aggression? Yes, in some cases. But the overall risk is hugely exaggerated.
So the link isn't as direct as people think.
Not at all. Factors like co-occurring substance abuse or having a history of violence before the illness or certain personality disorders, those are much stronger predictors of violence in anyone, including people with schizophrenia. It's not the schizophrenia itself usually.
That's such an important clarification. Hopefully that helps reduce some of the fear and stigma. Now, beyond the acute symptoms, how does just living with schizophrenia affect day-to-day life?
Well, the combination of all those symptoms, positive, negative, cognitive, can have a really profound impact, as you can imagine. Sources talk about significant difficulties many face in maintaining relationships, holding down a job, managing money, even basic self-care like hygiene or eating properly. Social situations can become incredibly challenging.
Even simple tasks might feel overwhelming.
Definitely. Things requiring organization, focus, motivation, they can become huge hurdles. If the condition isn't well managed, it can unfortunately lead to significant disability and dependence. And then there's the stigma.
Ah, yes, the social side.
Yeah, the stigma associated with schizophrenia just adds another heavy layer. It
Yeah.
can lead to social isolation, discrimination, loss of self-esteem, really compounding the practical challenges.
It really sounds like it touches almost every part of life.
It really can, which underscores why that comprehensive support is so vital. Maybe we should also quickly clarify the difference between schizophrenia and bipolar disorder. Sometimes people get them confused.
Oh, that's a good idea. Yeah, because both can involve psychosis sometimes, right?
Yeah.
What are the key differences?
Exactly. While both are serious mental illnesses, they're distinct. Schizophrenia's core features are those persistent disturbances in thinking, perception, behavior psychosis is often central and ongoing. Mood issues can happen, but they aren't the defining feature. The focus is more on that distorted reality.
Okay, and bipolar.
Bipolar disorder is primarily defined by significant mood swings, those major shifts between mania or hypomania, the highs, and depression, the lows. Psychosis can occur in bipolar, but usually only during those severe mood episodes. The defining feature is the mood cycling.
Got it. So schizophrenia, persistent reality distortion, thought disorder. Bipolar, primary issue is the extreme mood swings. That's helpful. Now, what about kids? Can children get schizophrenia?
It's much rarer than in adults, but yes, children can develop it. We call it childhood onset schizophrenia if it starts before 18. Very early onset, before age 13, is even rarer.
Is it different in children?
Symptoms can be harder to identify sometimes and might look a bit different, maybe less elaborate delusions or hallucinations, perhaps in more developmental issues, severe social withdrawal.
So it could impact their development significantly.
Absolutely. Which is why early diagnosis and specialized treatment are so critical in those rare cases. Genetics often play a strong role in childhood onset.
Underscores that need for early intervention again. And speaking of support, we absolutely have to talk about the role of caregivers, family, friends.
Oh, immensely important. Caregivers are often the backbone of support for someone with schizophrenia. It can be incredibly challenging, of course.
What kind of support do they typically provide?
So much. Emotional support, obviously. Practical help, like reminding about medication, getting to appointments. They often learn to recognize early warning signs of a relapse, help with daily living tasks, advocating within the healthcare system, trying to maintain a stable, understanding environment.
It sounds like a huge undertaking.
It really is. And that's why it's so important that caregivers get support themselves. resources, respite care, support groups for families. The burden can be immense, and they need help too.
A crucial point. Now, there's a difficult topic our sources touch on: life expectancy.
Yes. Unfortunately, the reality is that, on average, people with schizophrenia tend to have a shorter life expectancy than the general population,
How much shorter?
potentially by quite a bit, maybe 10 to 20 years, according to the research.
Wow. Why is that? Is it the illness itself?
It's mainly due to higher rates of other physical health problems, comorbid
Oh,
conditions.
go ahead.
Things like cardiovascular disease, diabetes, respiratory illnesses are much more common. This can be linked to lifestyle factors, sometimes side effects of medications, and often disparities in accessing good physical health care. People might not get the same level of preventative care or treatment for physical issues.
So it's the physical health complications often.
Largely, yes. Tragically, there's also a significantly higher risk of suicide compared to the general population.
That's heartbreaking.
It is, and it just highlights, again, the critical need for holistic care treatment that addresses both mental and physical well-being together.
Absolutely. Okay, let's shift to a more forward-looking perspective.
Okay.
What's happening in terms of research? Where are things heading?
Oh, there's a lot of really active and promising research going on. It's happening on many fronts.
Like genetics.
Definitely. Researchers are digging deeper into identifying specific genes involved, how they interact, how they combine with environmental factors. Neuroscience is huge too, using advanced brain imaging.
Like fMRIs.
Exactly, fMRI and other techniques to understand differences in brain structure, function, how different brain areas connect and communicate in people with schizophrenia.
What about new treatments?
Big focus there. Developing new medications, hopefully with fewer side effects, and crucially, trying to find drugs that work better for those negative and cognitive symptoms, which have always been harder to treat than the positive ones.
That would be a major breakthrough.
Huge. There's also a lot of work on early intervention, identifying people at high risk before they get fully ill or right at the very first signs, and developing ways to intervene early, maybe even prevent the full illness from developing.
Proactive care.
Exactly, and continued research into environmental factors, stress, substance use, infections, how they play a role, plus things like digital therapies are emerging using apps and online tools, and refining those integrated care models we talked about. There's even hope for more personalized medicine down the line, tailoring treatment based on someone's specific biology.
It sounds like there's a lot of momentum, a lot of effort going into improving things.
There really is. Dedicated people working hard.
So for anyone listening who might be affected or knows someone who is, where can they turn for reliable support and information? What are the key resources?
Okay, great question. First port of call is often qualified mental health professionals, psychiatrists, psychologists, therapists, clinical social workers. They're essential.
Right.
Then there are fantastic advocacy and support organizations. Groups like NAMI, the National Alliance on Mental Illness, and the Schizophrenia and Psychosis Action Alliance. They offer tons of education, support groups for individuals and families, resources, often helplines too.
Yeah.
Invaluable.
And AMI is a big one, yeah.
Very much so. Also, look into local community mental health services or centers in your area. They often provide clinical services and support programs.
What about online?
Online communities and forums can offer peer support, which can be helpful, but you do have to be a bit cautious about the reliability of information sometimes. Always cross-check with trusted sources.
Good point.
Family support groups are also specifically helpful for caregivers, a space to connect and share. And for just solid evidence-based info, organizations like the World Health Organization, WHO, are excellent resources.
That's a great list. It's clear that, well, schizophrenia is incredibly complex, isn't it?
Profoundly so.
But with understanding, with effective treatment, with strong support systems,
Yeah.
there really is hope for recovery and for people to lead meaningful lives.
Absolutely. And it really highlights our responsibility as a society, doesn't it? To shed that stigma, to ditch the fear, and just to approach people with compassion and understanding.
Yeah. It really does. You know, thinking about that interplay, you mentioned genetics and environment and all the research into early intervention. It makes you wonder, doesn't it?
Wonder what?
Like, what could the future look like if we got really good at identifying and supporting people at high risk before the illness fully takes hold? What difference could that make?
That's a powerful thought, a shift towards prevention and early targeted support. Yeah, that could be transformative.
It really could. So if you're listening and you or someone you know is experiencing symptoms that feel concerning, maybe related to what we've discussed, please don't hesitate. Reach out for professional help right away.
Yes, As we've said, early intervention really can make a huge positive difference.
Definitely. And please do explore the resources we mentioned if you want to learn more and deepen your understanding. Thank you so much for joining us for this deep dive.